All right, we're going to try this live thing again. This is new. I'm a newbie at this. We're using Juvederm Vollure, brand new product from Allergan, manufacturers of Botox. This product is really good for moderate to deeper wrinkles, but not quite as deep as, let's say, Voluma, which you probably know about. That creates a lot of lift. So it's somewhere between Volbella and Voluma in terms of its efficacy, very similar to the Juvederm product, the original Juvederm product. Kim is 49 years old. She looks younger than her age. She really hasn't done a lot of fillers and nothing with me yet. She was a little worried this morning about having a lot of pain because of not having a dental block, but I really only use dental blocks for around the mouth, and we're not going to do lips today, so absolutely not necessary. We're going to do a lot of techniques to make it not painful for her. So this new product is going to be good to reduce swelling. Unlike Juvederm, it may have a little less swelling. So we're going to really work around framing the face. Before we start, I just want to spend a couple minutes and walk you through the analysis here. The one thing I always tell patients is not to put a lot in the cheeks because they look cheeky. This is her native cheek. She's not had any fillers there, so it's a pretty cheek, but I don't want to add any more there because it's going to look too big when people smile. So it's an area that's very important not to overfill. What we want to do when we're looking at a face is to create a more youthful shape. So what that is more attention up high. So today we're filling down low. You're going to say, well, wait a second, Dr. Lamb, if you're going to fill down low, how are you going to make this face slimmer? Are you going to make it heavier? No. So there's a little bit of squaring that occurs with aging here. And what I want to do is actually do a little work and put attention around the front. When you put attention around the front, it draws this forward so the width of the face looks smaller. So this is part of the aesthetic design. One of the major concerns people always have is, will I look different? No. Everyone will look very, very similar. So the same as before, the identity does not change. But we just want to just slim the face, bring the cheek and blend it into the lower face, and create a little bit of thinning of the early little jowl area. So Darla is my assistant. We're going to get started here. The first thing we're going to do here is I'm going to work from top down. So we're using a cannula technique for the upper area right here. The reason for this is that this area is a watershed zone that can cause problems with vascular or blood supply integrity. So I only use cannulas in this area for safety, so no needle injections. A cannula basically is a needle without a sharp end. So you can see here, it doesn't hurt, okay? So we're gonna go ahead and do that here. Darla's gonna help me with vibration, so we're just doing a lot of vibration. That vibration technique really makes it virtually painless, which I'm hoping. Kim, you're doing okay?
I'm doing just fine.
Good. Your lip is gonna feel a little numb here, okay? That's normal. So what we're going to do is just put this product in, and please let me know if you're having too much discomfort. You can start seeing the effacement. I believe that what's really important is not to overfill this area because this can actually contribute to too much fullness in the zone. So just enough that will make a nice difference for her. And I think probably about a half a syringe is plenty. And you can start to see the effacement now. If you notice what I'm filling, I'm actually filling primarily high in what's called the canine fossa. I believe that the changing of the canine fossa makes the whole face look younger. In addition, what you're seeing when you fill this zone is that a lot of the studies, a colleague of mine out of Los Angeles was looking at aging, and he found that the canine fossa is really an area of primary interest because when you change that area, the entire face shape just looks so much softer. But you can see what's very interesting is you look at the cheek structure blending better into the lower face. So what I'm trying to do is really blend parts of the face into one another. And so the fewer transitions of the face, the more youthful the face is. And that's really the illusion. I spend my life thinking and rethinking and thinking about what makes a face look more attractive, youthful. And so, you know, during a consultation, Kim is an interior designer, so she really sits down and works with her clients. She's worked with me just to really sit down and talk to them about what they want, and then also giving them advice, because sometimes you actually don't know what you need or what you want until the person with experience tells you this. So for me, a filling a fold is not always the priority. It's one element. It's one element of the design. Today we're just focusing on this area because this product is really good for the lower face, and it's FDA clear for these deeper areas. But you can start seeing it's a much softer look, and it's very fast and hopefully not too uncomfortable. Not too bad?
Not too bad.
Okay, and the key with this is that one side is going to be different from the other. You can sit here trying to get them equal, and you can never do it. Symmetry is elusive goal. So we're going to do the next syringe. Now, the two areas left we're going to do, not much longer in this video, is here and here. So the little downturn is a really hard area to completely efface. We're just going to try to lift it up a little bit this way. Now, we're going to use a needle here. And why use a needle in this area? Because this area is very safe. It also is a dermal problem. So in other words, it's closer to the skin edge. So I need to just get a little closer to the skin edge to lift it. And we'll go back to the cannula here. So we'll see this action here. A lot of vibration makes it less uncomfortable. There's a little bit of lidocaine in here. That's why Kim's lip probably feels slightly numb in the upper lip. And so we're just going to slowly fill this up in a very gentle fashion. Never want to overfill. And the art of this is just putting a little bit in there to create a little bit better shape. So you can see that it's gone from a 45-degree angle to about a 90-degree. And that's all you really want to accomplish. You don't want to really overfill anything. You see a lot of overfilled looks, and I think the reason is you're putting too much product in a single zone. And what I'm trying to do is just blend things together. So you're seeing this softening. We're getting it very close. Now, this part we want to get even closer to the dermal edge, and vibration makes it a little bit more comfortable. So my goal is always for patients to feel comfort. The number one reason a patient doesn't come back to the doctor is pain. So we don't want that. Kim, how are you?
It was not painful.
Easy. You don't need a dental block, right?
Not at all.
And wait till you try my dental blocks in the future. It's painless. Okay, we're almost done. So this is a very important area. It's called the pre-jowl. Essentially what a pre-jowl is, as this name defines, is before the jowl. So this slight heaviness that starts to occur with aging, with the loss that's here, if we can fill a little bit across here, it will streamline the jawline. It's what my colleague calls a fake lift, because essentially what it does is it looks like the illusion of a facelift. It creates a much better profile and a little bit less of a jowl appearance, which is really important. So that vibration, it's like an earthquake in California here, so that she feels less discomfort. And we just fill. And the trick with this is not just filling the anterior aspect of the jawline, but actually aiming down a little bit, because you got to capture the jowl itself going down. So we're trying to go down a little bit here to actually capture the hanging portion of the jowl. And you'll see that the face will look a little slimmer through this technique. These are 25 gauge cannulas. And why use a 25 gauge cannula? They've shown studies that in terms of vascular problems and risk, you really need to be using a larger size cannula for safety. So if you're using 27s and 30s, there's a little higher risk. We need to go back and do a little bit more on the other side. Just looking for the little entry side here. Let me go back a little bit farther. There we go. You doing okay?
Okay.
Good. So we're just filling again a little bit more inferior aspect, not just all anterior aspect, to reshape this. A lot better. I think it needs a little bit more. And again, that violent shaking is to minimize discomfort. I'm going to use a little bit more. Let me get one more. Okay, so if you take a look here as we're going across, the face is already slimming. It's a very, very elegant look. The shape is improved. We've gotten close to a 90-degree angle on the marionette. We blended the cheek into the lower face, and I think she just looks softer, more balanced, more blended. In fact, I may do a little bit of creativity over there too, but we're good here. Let's enter through here. Hard to get through this. There we go. All right.  1, You can see a little bit better shape to the jawline. I need to get a little bit lateral. I'm just going to come back this direction here. You hanging in there?
I'm fine.
Good. So I'm missing a little bit posteriorly in the jowl, just filling up right here. There, jawline looks so much cleaner. This side's actually pretty good. I don't think it needs any more. So this was a slightly heavier jowl than the right. What I'm going to do here, the final little bit left over for what I want to do, is create a little bit better shape right across here. And this will finish that oval shaped face of the face. So, a little bit left, not much more to do here. Of course, on the camera, I can never find the entry. You okay?
I'm okay.
Okay, this is it. Just shaping this outer face. Great. Can you see how this side, where this dent accentuates here? So I want to create, if you look at this side, it's a better youthful shape. There, that little dent of the temple outer face creates a little bit of the fact that this looks flared. By filling this, the shape of the face changes in a good way. So this is the very final part of the product. There's 3 syringes in here. And this is the end of it. Sort of lower temple shape. And that is the end of the presentation, but I'm going to just show Kim this result here. Now sometimes the patients cannot see the difference immediately afterwards because things are a little swollen. Hopefully Kim can. Was it too uncomfortable?
It was not too uncomfortable at all.
Good.
It's definitely worth it.
Let's take a look.
Oh, wow.
You see the jawline is
That
cleaner?
looks fantastic.
A lot softer, right? And what I've done here is just to create a little better shape to the face as well.
That looks fantastic.
Good.
I can tell a huge difference.
All right, guys, that's it.
That's
Thank you.
incredible. Thank you.